Hello, it's Bill, the Knee Pain Guru, and welcome to the Pain Education Podcast brought to you by the Camella Foundation. We are doing a summer series, 6-part summer series on natural healing for ACL injuries and tears. And this came about as a conversation with Christina Thavos, a conversation we had about just natural approaches that breaking down the entire conversation around ACL injuries and seeing how we can come from a very natural approach in terms of addressing what's going on with an ACL injury. And a lot of that is some foundational work we'll do in the first couple of podcasts, because it may not be an ACL injury. You know, there's a lot of things to consider. So, well, with that being said, welcome, Christina.
Hi.
Hi there. Share your background with the audience as far as your training and education.
Yeah, I'm a trained professional homeopath. I've been in the field since 2004. And so natural healing and alternative methods have been huge in my world for a long time, since the mid 90s. So when I started seeing about your work and learning what you're doing, you know, with all the repair work that you do, or it was just amazing. Like, it seemed like a really good merging of what I do, working with the chemical and electrical balance, and then what you do with the physical body. So it's really exciting to work with you.
Well, yes, absolutely. And at the Camella Foundation, our focus is on natural healing coming from a perspective of osteopathic healing principles. And that basis is structure governs function. So if the body is structurally in place, then everything else has the opportunity to come online. And where I see homeopathy being a very good merger of that is getting the neurology, or your body's reflexes, to kick in based on the remedy that would be ideal for the situation of what the person is dealing with their knee injury. So anyhow, we have a 6-part series. We're going to dig in deep. We've already gone into some in-depth conversations, so we're going to dig into that today. Begin to dig into that today, and we'll have series of 5 podcasts after this that'll dig in deeper. So today's podcast, we're going to cover you've injured your ACL, now what? That's a topic. And a lot of times, and that's how I got into everything that I'm doing, was an ACL injury, or it was a knee injury. And I didn't know at the time that it was actually an ACL injury. Mm-hmm. So hopefully this is going to help lots of people who have knee injuries, that can save them a lot of anguish that I needed to go through with my 4 knee dislocations before I went to the doctor to find out what was going on with my knee. And that ties into one of the first components that we'll talk about, which is mindset. And mindset, as far as at the time that I injured my knee, I felt like I was invincible. I was in my late 20s. I'd never had a joint injury. So it was like, well, I'll just walk it off, rub some dirt on it. You know, everything will be okay. And what happened was, I found out that there was an instability in the joint. The joint would lock, the joint would give way, and I'd never experienced anything like that before. So it was kind of a foreign concept for me, that there would be something torn in the joint itself. Mm-hmm. So there was a mindset that I needed to change, that it was like, how
can this happen to me?
How could this happen to me? But
right.
I needed help outside of myself. Like, I needed to do something more than what I knew how to do, or what natural healing at that time that I was aware of was able to help with what was going on with my knee. Mm-hmm. So that required me going to the doctor. And after the 4th knee dislocation, I did. And that was quite a humbling experience to be told by the doctor that I had torn the ligament in my left knee. And what did you want to do? So from the time of the injury to the time I went to the doctor, there was an infinite number of baby steps in there that I could have taken that could have and would have changed the trajectory of my life, or
Mhm.
how that injury would have went if I would have known what I know now. So definitely want to share that. And the big thing is knowing what you're dealing with. A lot of times we have a knee injury and many people go to the internet and they want to figure out what is going on with their knee and get a diagnosis on the internet. And it tends not to work that way. As a matter of fact, it doesn't work that way.
Which
Uh,
is kind of funny because for some things that can actually be like to your benefit, but I definitely would concur with what I've seen that for joint injuries and like things in the physical body like that, the neuromuscular, it can be really helpful, very, very needed to get a diagnosis.
sure. And we're looking that something is broken or torn.
Mhm.
That's what we're trying to either determine that that is what has happened or rule out. Because I believe the conventional medical model has a role, a very valuable role in the body's healing. And it also has its limitations. And it's important to understand where those lines are. And if you fall into the conventional medical model, then absolutely stand in that box and get the support you can from the conventional medical model. But if you don't fall in that box, then there are a number of things you can do that is going to be infinitely helpful. So I'm curious if there are any remedies that are coming to mind that would have helped. I'm going to throw out the stubbornness, the resistance to going to a doctor, the a tunnel vision that it's like I'm going to fix this myself. I'm curious if there's any specific remedies that can support someone who's in that space.
So some of that is like a chronic mindset thing. And so you're looking at like long-term treatment, but it's really interesting that the remedy Arnica montana, which is pretty much if you have any accident, injury, trauma, like anything like that, the very first thing you should think of homeopathically is Arnica montana. And it's curious that one of the main symptoms is the person who's gotten injured saying, I don't need help, everything's fine.
Gotcha.
It comes out in the provings. So I'd say that like across the board, you use that a lot in your practice too. And like first intention healing for injuries, Arnica.
Mhm. Uh, so one of the things that comes to mind is there's a lot of different strengths of Arnica.
Yes.
I've seen, and I'm not as well versed as you are, of course, 6C, 10X,
Yes.
30X, 30C, 200C. Can you help someone that, because they could get Arnica at a local health food store, or they could order it online, something like that. Can you give someone who would be in a similar situation as I was in when I injured my knee, the what they would be looking for or asking for if they went to a local health food store?
That's a great question because that is potencies. There's a lot of confusion about that. Um, we usually pick potencies based on the intensity of the symptoms. So if you're going with a big injury like that, where you're in a lot of pain, a 200C is going to be a great choice. Um, it'll give you, because it'll really reach in there and give you the pain relief that you need. And you can repeat that as needed as the pain comes back. I think that's one place where people fail when using homeopathies. They're like, well, I took one and it didn't do anything. It's like, okay, well, what happened when the pain started coming back?
Right.
And when you get to repeat the dose.
Right.
And usually just taking a pellet, that can be your dose, one pellet, when you're in an intense situation like that.
And I think I run into it even when working with clients, is that they only take it once. They have the mindset of how the conventional medical model works, that it's going to be like Tylenol, Advil, Nuprin, or it's some sort of painkiller, Percocet, whatever.
Right. And we're working with different mechanisms here. You know, a conventional painkiller like Tylenol, Percocet, and Nuprin work by suppressing the pain. They actually turn off the pain receptor sites in the body. And so it works with a chemical suppressant. The homeopathic remedies kick in the body's self-reparative mechanisms. So they actually promote healing at the same time as they are healing, if that may, or turning off the pain. They promote healing while they're turning off the pain. So you may have to repeat the dose every 15 minutes when you're in super acute pain. And that's okay. That does not mean that the pain, that the Arnica or whatever remedy is best for that situation. It doesn't mean it's not working. It just means you keep renewing that dose and your body keeps responding, and then you go from there.
One of the things that I've noticed, especially in using homeopathic remedies, is that there isn't that immediate kind of like, oh, the pain is gone. It almost, the analogy that I would use, it's kind of like a train going down the tracks, and it gets quieter and quieter and quieter, and
That's
pretty
really good.
you hear it.
Yeah.
And that has been my experience in using Arnica, especially with when I used to compete in judo, as well as with my knee injury, that it would begin to mute the pain. It wouldn't make it completely go away, but it would mute it. And then all of a sudden it's like, oh yeah, my knee, it's not bothering me anymore.
Yeah. And we see people tend to have different response times. Like you and I would probably have different response times. Like a lot of times I'll take a remedy and within a few seconds, I start noticing a shift in an acute situation. I had a client, and we found this out when they injured the cartilage in their knee, that the remedy did not kick in until a full 10 minutes after taking the remedy. So it's good. The more you use homeopathy, the more you kind of understand how your body responds to it. So then you start to understand like what your response time is going to be. So you can kind of plan ahead and understand, you know, how to manage pain, and I think we'll just keep it to pain right now, since that's the topic of the conversation.
Sure. But I did want to address that in terms of managing expectations. That it's a learning process, and from a conventional approach, we're looking to numb the pain, and from a homeopathic approach, we're looking to encourage the body's ability to heal faster. Very similar to that, to an osteopathic approach. We want there's the wanting to create the alignment in the physical body, so then the body's healing mechanism can kick into place.
Yeah, and I really like your analogy too of the train kind of going off. That's really good visual for it.
And once again, this is like something's happened to the knee. We don't know what's going on with the knee, and we're still moving in the direction of getting help and support from the doctor.
Yes. What's interesting too about the way the remedies work is that as you're like, you'll come back and be like, check in with somebody 10 minutes later after a remedy, and they'll have to think about how they're feeling because they don't remember how they were feeling before too. And so the remedy actually helps prevent you getting locked into that neurological pattern of, ouch, I'm in pain. So it's like it kind of prevents PTSD from setting in because it's causing the body to heal automatically rather than turning off the pain receptors and then still leaving the rest of your neurology to deal with the shock of the injury. So that's a really cool benefit.
And it's important to understand, when we have a traumatic injury, like a knee injury, like an ACL tear, either a partial or fully torn, there's a degree of the nervous system needs to shut down and mute that experience, because when you have that shock,
Mhm.
trauma that has entered into the body through the injury, what ends up happening is if we were to have all the experience that our nervous system has to offer at the moment of time of the injury, it would kill us.
Mhm.
And that's why there's degrees of shock that will set in to the ring in the ears, the blacking out or whatever it is, so the body can begin to integrate this change.
Right.
And I like the capacity that homeopathy has, and in this case, Arnica montana, as a way of helping to integrate that change without it being so traumatic.
Yeah, it's actually one of our number one remedies for shock and trauma from injuries and
Mhm.
emotional, big emotional experiences. And when you injure a body part like that, there is an emotional shock that happens too. It's like, oh my God, I just did something to me. And you start, that cascade of thoughts can come in like, where is this going to lead me? My life is over. There's a lot of things that can come up. And the arnica does help
Mhm.
lessen that response.
Um, so one of the next piece I want to get into is getting in to see a doctor and determining if it's an ACL tear. And this was one of the things that I found out. Many people think you have to get an X-ray, a CT scan, an MRI in order to identify if something is torn in the knee.
Mhm.
And there is also a test. It's called the Lockman's test that doctors, physical therapists, occupational therapists, some chiropractors know how to do a Lockman's test, and this tests the tension in the ligaments in the knee.
Interesting.
The ligaments kind of hold the bones together like a guide wires.
Mhm.
And if they'll test, they're supporting the heel, and they have the hand up underneath the calf, and they're doing specific tests to see how much the knee will stretch. And if the ligaments aren't intact, then what can happen is the knee will just keep stretching.
Oh,
And
wow.
it's kind of an unnerving feeling, because my ligament wasn't intact when Dr. Ellis was checking that, and the knee just keeps stretching or in that certain direction.
Oh,
Because if they're doing the Lockman's test, they're testing for the different ligaments, the ACL, the MCL, the PCL, all of those different types of ligaments in the knee can be determined if they're intact or not.
I
Uh,
love all those old palpation skills that they used to teach doctors are so, so valuable.
sure. Yeah, it's absolutely very good. Uh, so that is a test that if you have someone, your doctor, your physical therapist, occupational therapist, whoever that is, um, can, and they know how to do these tests, that can determine whether the ACL is torn or not. Of course, the highest standard we're going here is going to a doctor and getting an official diagnosis. That's ultimately what we're going for. We want to, there's a lot to talk about here, and sometimes it can get confusing, especially if you're trying to deal with the pain and the trauma from the injury that is you've just been through, and now you're trying to sort through all of this in your brain while determining, well, I want to get back to my life, because this is all the stuff
Now what?
this is all the stuff I struggled with. I didn't want to admit that there was something wrong with my knee. So I
Yeah.
was fighting me wanting things to be normal again, and all this rabbit hole, because it is a rabbit hole to go down, when you're trying to determine, do I need to go see a doctor? If I decide to go see a doctor, what doctor do I need to see do I need to go see?
Yes.
Do I find my information on the internet? Do I go to my physical therapist buddy? I know a chiropractor. Can they check out this stuff? So there's a lot of different things that were running through my brain to figure out what was going on.
So there's another remedy that's coming to mind too. Like when you find yourself kind of getting into that state of fear and panic and overwhelmed because of the impending situation that you're dealing with and handling what's just happened. The remedy aconite it's also called Aconitum napaelus. But aconite, if you say that to anybody at a health food store, they'll know what you're talking about. In a 30C potency is really, really helpful to help with that fear and anxiety that can come up when you're getting overwhelmed in these situations. I think it's worth mentioning too that the emotional component that comes along with injuries, that's another place where homeopathy really, really shines in its ability to help with that. Because I don't often talk about that when dealing with injuries.
Mhm. This is all valuable, and this is why there's this physical process you're going through with a knee injury, and then the supporting remedy that can help you through it, so it isn't as difficult or challenging to go through while you're dealing with it. So I want to go over finding the best doctor for your knee situation. This is huge, and this
Yeah.
is something that it takes a lot of the fear and concern out of approaching the conventional medical model with worry that you're going to get the support that is going to be the best for you. There is a lot of mistrust in the conventional medical model nowadays. So how we can dissipate that fear of someone who's going to see a doctor, how we can do that the best. The first is when you look for a doctor, and this is something that I, in hindsight, figured out. It was not something that I knew going into it, but you can contact one of your local professional sports teams if you live in a large enough city, or a local collegiate college or university, and contact their athletic department, contact their athletic director, and find out what doctor they send all their athletes to. Because every university has one. They have their go-to guy. And the reason being is you want someone who doesn't need the work. You want someone that is familiar with joint injuries and is going to get down to the brass tacks of what you need to get back up and running as quickly as possible. So if you have a doctor that is working with professional athletes or collegiate athletes that don't want to screw around, they want to get in there, they want to know what's going on with their knee, and they want to get the solution, be it surgery, or the doctor's going to tell you the truth. You just need to go to physical therapy, or you just need to lay off the knee for a while. You're going to get that straight to the point answer from that doctor, as opposed to another one who doesn't see joint injuries all that much, or whoever it is.
Right.
So
That's such a good tip too. That's really, really
it's big.
valuable. It is.
And then that type of doctor is used to ordering X-rays, CT scans, MRIs, and knows the imaging, because this is important too. A Lockman's test is going to tell if the ligament is torn, but it's not necessarily going to give an indication of the degree of tear, or if there's other damage going on in the knee, like a meniscal tear, or fracture of a bone in your knee, or a ligament tear, or I'm sorry, a tear of the tendon or muscle. So those other imaging, X-ray, CT scan, MRI, ultrasound, those are the different types of imaging that we can get of the knee, and a really high quality orthopedic surgeon that works with collegiate or professional athletes is going to know the specific one that is going to identify, zero in on what's going on with your knee, get those results, and can get you, at the very least, the peace of mind of knowing exactly what you're dealing with. Because this is what, from the time of the injury until that point, it's a little bit of a like a black box. Something went in, something happened, but we don't know what exactly needs to be dealt with.
And I just want to make it super clear for people watching that the different tests that you mentioned, the MRI, CAT scan, ultrasound, et cetera, they all pick up on different aspects of an injury.
Yes. Yes. They're not all the same, and certain images will be used for certain types of symptoms that you're experiencing, and not for others.
So
And-
that's why you're saying to bring in the specialist who knows the specific one to order,
Right.
because they already know like where they're looking to for the injury, what kind of
Right.
injury it might be.
They're familiar with the different types of injuries, and they're going to order, for instance, an X-ray. A lot of people get X-rays of their knees, and an X-ray doesn't necessarily show tendons and ligaments. And if you have an ACL injury, you're not going to be able to see what's torn on an X-ray. So, and once again, this is a conversation you have with your doctor that's going to really know how to guide you and direct you through this process.
Right. And I think it's important for us to say too, like, we're not giving medical advice. We're not medical doctors. We're simply providing education from the decades of experience that we've had working with hundreds of clients, thousands of clients, Bill, in your case, from practical experience, it's really hard to come by.
Yeah. Well, I had to injure my knee to begin my training.
Right.
And this was stuff that, once again, I went into it not really knowing what was going on. And for all intents and purposes, things turned out really well. I ended up with a great doctor, Dr. John Ellis, who took care of all the University of Louisville and Louisville, Kentucky, all of their sports athletes.
Right.
So he was a no nonsense kind of guy. And honestly, I didn't even get any imaging on my knee. He did the Lockman's tests, and he goes, Bill, we could do an MRI, but it'd be a waste of money. You tore the ACL in your knee.
That's great.
So,
and see,
so
that's the poor piece about, they don't have anything to gain. They don't need you as a client, a customer or patient.
right.
So they're not trying to make the money off the imaging. That's
Right.
really important.
So that in a way, going to a better doctor may cost money in the short term, but in the long term, that high quality doctor is going to save you a lot of heartache and stress and things like that. And you're going to get down to what's going to make the biggest difference in the shortest period of time. Let me see. I'm looking at the notes here. Talk about the best doctor strategy.
I think it's also important too that to start working with homeopathic remedies, it's really helpful too for me to know like specifically what's happening, but there's a lot we can do in the meantime to mitigate the pain, the swelling, any blunt force trauma from the injury, any emotional stuff coming up before you have the diagnosis. And so you can get yourself into a better position already, like, or positioning yourself, already for a great strategy to healing by starting, homeopathic treatment or, right away.
Right. And I also want to point out the value of bringing homeopathy into the conversation, because the more clear you are in your head when you're going through this, you're going to make better decisions about what you're going through.
That's such a good
You
point.
could,
Yes.
it's a big piece. Like, I was very clear when Dr. Ellis told me your ACL is torn, and I was still competing in judo. And there wasn't any question in my mind that I still wanted to compete. There wasn't any, it was like, okay, when can we schedule a surgery? That was like true for me. And there was no question in my mind that I wanted to, what I'd been going through, hedging on wondering if my leg was going to lock up again, if my knee was going to dislocate again, if I was going to deal with the pain again, my knee was going to blow up like a balloon again. Like, I don't want to deal with that.
Right.
There was nothing in me that had a question about that direction that I was going. And and this is hindsight, if I would have went to Dr. Ellis after the first knee dislocation, instead of waiting for 4, I would have only been dealing with a partial tear in the ligament in my left knee. And dealing with a partial tear is a completely different animal than dealing with a full ACL tear that was only partially attached, 30% attached on the other end.
Yeah.
So I want people
It's,
to, be in it. It's like, okay, I
yeah.
got this knee injury, but also look at, as we collect information, if I'm getting out of that fear pattern of what's gone on with my knee, and that I'm not being stubborn and just being like, okay, my body, there's nothing going on. I'm in denial, sticking my head in the sand.
Right.
Anything's going on. I would have made better choices after the first knee dislocation.
Yeah.
Maybe after the second, or maybe after the third, instead of waiting till the 4th and then have to be carried off of the softball field and then then make an appointment and go to the doctor and then find out the ligament was torn. That level of trauma that my body had been to was 4 times as much as if I just would have went the first time.
Yeah. And you went through a process too of also learning to listen, to yourself. I think you and I are really big on getting really quiet and listening in the stillness to what your body's saying, what your intuition is telling you, where you're being guided. And when you can get into that calm space, like homeopathic remedies are super helpful, breath work's really helpful, meditation, there's a lot of tools that we have to calm that neurology, calm those emotions that come up, but it just can't be understated how, or overstated, I think we'll go with overstated, how important it is to get back to that calm baseline so that you do make rational, clear decisions. I can't tell you how many people I see that clients that I'm working with, they, get a cancer diagnosis, for example, and they go into total fear and panic, and they just go straight into conventional treatment, chemo, radiation, and surgery without realizing that they have time and they have the choice to go into looking at other options because they're not looking to calm that emotional panic and fear and whatever else comes up for you first. And so it's just so important.
Yeah.
In anything you do.
Yes. So I want to share this, from a professional perspective, as well as my own personal experience of having now 25 years of hindsight as to how I could have dealt with that situation differently. And once we find out the information, this is not even to say, hey, you got to get the surgery, or hey, you got to deal with it naturally. There's an infinite number of different options in that process.
Definitely.
And it's important to understand, we want to put the doctor's role in perspective of the larger strategy you choose. And we're going to go into this in future podcasts in this series. We want to make sure we have the end in mind. What is the ideal outcome? For me, the ideal outcome was getting back onto the judo mat and not have to worry about my knee popping out of joint. So that was my done. My done now is very different, or what I would have chosen is very different now than it would have been 20 some years ago. However, when you determine what done is, whatever that is, based on your age, your lifestyle, your activity level, all of that stuff, once you figure out what complete is, the finish line of your knee back to whatever that is, you can see what role the doctor plays in that. So that's important to kind of weave it all together to understand exactly how you want to approach the situation. Because when you're sitting there in the doctor's office, and I know I felt this pressure, when you're sitting there in the doctor's office and the doctor gives you a diagnosis, you feel compelled to give an answer right there and then.
So good. Good.
And this is what happens. People will make choices. Well, I'll just have the knee replacement, or I'll just have the knee surgery. I'll just have whatever that is. I'll take the pill. I'll take the shot at that time. And many people don't realize that that's our fear kicking in, making that decision, not you stepping back, coming from a place of being calm and centered and focused and going, oh, I think I'm going to think about this for a minute. I see I'm kind of, my nervous system's all amped up, and I need to calm myself down, make another appointment, and maybe come back in a week or so.
Right. There's also the feeling of obligation. They're a doctor, they're a professional, they know better than me. Who am I? What do I know? I need to do what they say, and we can really disempower ourselves when we put all that authority there without taking a step back to see what really feels good and what, we need to do.
Yeah. And when we talk about feels good, this is not like all airy fairy. This is grounded. This is like, okay, what makes sense for me at this point in time in my life? And a lot of times it's like a child when it's like they want the thing, but they're not putting it in context of everything else that's going on in their life, or what's happening that day, or what's going on that week. They just want the thing. And when we get into that fear pattern, it locks us into this tunnel vision that it's like, okay, I need to make this decision right here, right now, because, and whatever the reason is, but primarily fear plays such a huge role. So the more we could calm down the neurology, which is why we're talking about the homeopathic remedies, and we've gone over Arnica and Aconite, which we'll put in the show notes of this, and it'll be in this blog post, as to more information on that. But that's kind of what we wanted to cover on the first podcast. And the next one, we're going to go in more in depth on understanding your ACL injury. That is a big piece of that, because there's a lot of nuances to knee injuries, be it ACL or otherwise. And we're going to go into detail on that on the next podcast.
We'll also talk a little bit more about homeopathic pain relief and, some of the things that are really important when you're talking to a homeopath, in the information that we need to be able to give a remedy to you that covers specifically what you're experiencing.
Yes, because there's a different mindset in terms of information that needs to be provided that's valuable to a homeopath that means absolutely nothing to a conventional doctor.
Right. They'll be like, why are you telling me all this? You need to go to the psychiatrist.
Right.
I don't want to hear that.
And the doctors, they're just not trained. They're trained in a different way and this is part of understanding the box of when you fall into what a doctor can help you with. Absolutely get that help and support from a doctor. We begin to realize that box is more nuanced than we're aware of. So, when you're in the box, for the conventional medical model and know the power of these other support systems.
And the power of stepping back and taking a moment to make a decision.
Yes. Make a choice.
Yes, make a choice.
Okay.
All right, you
Cool.
guys.
Well, thank you, Christina. It was
Thank
I
you,
think
Bill.
this was a good one for the first one, and then we're gonna get ready for that next podcast. And
Yeah.
so we'll wrap it up for today. This is Bill Paravano, the knee pain guru,
And Christina Thieves.
on behalf of the Pain Education Podcast, brought to you by the Camella Foundation. Thanking you so much for being here. And make sure you head on over to the camellafoundation.org. We'll have that in the show notes as well, to like, subscribe, all that kind of good stuff. That information will be down below. Thank you so much. Have a great day, and we will see you on the next one.